Hi, I'm Dr. Thad Deal, and I'm a board-certified chiropractor. In our office, we focus on chronic, difficult-to-treat conditions, including thyroid problems. I see a large number of patients who, despite being placed on thyroid replacement hormone, still suffer from many of the symptoms of low thyroid function, including fatigue, weight gain, hair loss, constipation, a low libido, cold hands or feet, depression, insomnia, or a rapid irregular heart rate. Either that, or I see another group of patients who have long suspected that they have thyroid problems, only be told over and over again that their lab tests are normal. That may or may not be true. You see, part of the problem is with how we define normal. Essentially, everyone who has had labs done at a particular location has a bell curve analysis applied to those results, and they throw out the really low and the really high, and everything in between is considered normal. What's worse is these lab ranges are non-standardized, meaning they can vary from lab to lab and state to state. So you could have a thyroid problem in California and not in Pennsylvania. And last but not least is the insurance company's influence on the panels which are ordered. You see, most doctors only run a partial panel because most insurance companies won't pay for a complete lab analysis of the thyroid because it doesn't affect their treatment. The only treatment option they have is thyroid replacement hormone, and if that doesn't work, they begin to medicate each individual symptom individually. We successfully use protocols developed and taught by renowned thyroid expert Dr. Tatis Karazian in our office. You see, by doing a complete thyroid panel, we can identify the precise mechanism of why you have low thyroid function, because there are as many as 22 published mechanisms by which the thyroid can malfunction, and only really one of those is going to respond favorably to thyroid replacement hormone, which explains why so many people are still suffering needlessly. These 22 mechanisms fall into 6 basic patterns, the first of which is primary or thyroid dysfunction. Now, even though this would respond favorably to thyroid replacement hormone in some cases, most of these people are being missed because those TSH levels are far too broad to pick up minor fluctuations in thyroid physiology. And the biggest reason is the number one cause in industrial societies of low thyroid or primary hypothyroidism is an autoimmune condition called Hashimoto's. And these people are not going to respond favorably to thyroid replacement hormone. The second major pattern of thyroid dysfunction is pituitary hypofunction. And this can be due to stress or oftentimes postpartum. The third problem is underconversion. You see, your body uses T3, which is the most metabolically active form of thyroid hormone, but largely the thyroid produces T4. So if your body is unable to convert T4 to T3, you're going to suffer from symptoms of low thyroid function. Another problem can be overconversion, which doesn't sound like it should be a problem at all, but if there's too much thyroid hormone available, the cell's receptors become resistant and they shut down, and this is most likely caused to increase testosterone levels. Fifth cause is increased binding globulins. You see, hormones, especially thyroid hormones, travel through the bloodstream attached to proteins. If there's too many of these binding globulins, there's not enough free hormone available, and you're going to suffer from symptoms of hypothyroidism. And last is resistance, when the cell's receptors simply aren't responsive to the thyroid hormone that is available. And unless we do all the testing to determine exactly what the mechanism is, we're not going to know what's going on with your thyroid. In order to find out, we need to look at not only TSH, but total T4, free T4, something called your free thyroxine index, T3, free T3, something called T3 uptake, and thyroid binding globulins. We also need to check for those antibodies, TPO and TBG, to determine whether or not you have an autoimmune condition. And it's also a good idea to check cortisol levels, as they'll affect thyroid function. We want to also look at all the other factors that can contribute to your thyroid problem or prevent you from getting better, and then address them through diet, lifestyle, and if appropriate, specific neurometabolic care.